Welcome to Behind the Citgo, where we pull back the curtain on the unseen truth of addiction recovery and talk about things most people never get a chance to see. I'm your host, Josh Torbich. Each week, we're sitting down with people who lived it, led it, and are still learning from it today. This isn't polished, it's real, it's raw, and it's noted in the faith and hope because we do recover. So whether you're in recovery, walking alongside someone who is, or just trying to understand what healing really looks like, you came to the right place. Let's dig in. Hey everyone, welcome back. Another episode of Behind the Citgo. That's right, we found ourselves sitting right behind it this morning. We're logging on with my very dear friend, Jeremy Seamon. Jeremy Seamon is the clinical director the director over at Coastal Horizons right here in Brunswick, and I thought of him as the perfect person to come and talk about today's topic. And here it is, everyone, the question that everyone's been waiting for. It's, Jeremy, it's therapy. Is it helping, and when should I stop? Yeah, I mean, it's a question you've heard before, yes?
It is. Yeah, absolutely. And I think the question is very much a part of the answer is very much a part of your story.
So I have a question back to you that's going to be a little bit of an analogy, and that analogy is about the car you drive, okay? So how long, Josh Torbich, do you like to drive a car? In other words, some people like to just turn it in every year, get a new car. Some people like to drive it till the wheels fall off. Sometimes people will keep an eye on value. What about you? How long do you like to drive a car?
Well, because you asked, yeah, I'm glad.
Okay.
Philosophically, I've had an approach for the past 10 years about driving cars, and it was taught to me in the form of equity. All right, so this is more than what you wanted, but since you asked, I'm going to tell you.
Exactly
but I'm going to give the very short version so I don't bore everybody with this finance lesson, all right?
Yeah.
I would go and purchase a new car every 2 years.
Okay.
Over the past 10 years, working myself up into larger down payments so I could finally afford a brand new vehicle. So I was a 2-year guy for the past 10 years, and guess what I finally got to? I had to sell it quickly because then my wife needed a new vehicle. But I finally got to buy my brand new F-150, and that was like 3 years ago. I finally made it. And then I had to sell it so I could get Casey a brand new Expedition.
Very nice, very nice. Okay. So that was a very individualized question. If we had somebody else on, they might answer that really differently. I'm going to say my individualized answer is I love my cars. I named my car. I drive it way past the time that I've paid it off. My car's getting ready to hit 200,000 miles, and the idea of not having this car, I mean, I'm just, Blue Betty, I just don't want Blue Betty to die. I'm at that point. I think it's possible in the next year or two, Blue Betty might die, and it's just making me, it's upsetting me, right? So there are some people that just, want a new car all the time. There are people that go every couple years. You said every couple years. But then here's the follow-up question to that. When is it a good idea for any of us who own cars, lease cars, to not change the oil in our cars?
You got to change the oil. Yeah, never.
Yeah, so whether you've got one that's like me, that's 10 years old, whether you've got one that's a year old, if you stop changing the oil, what's going to happen to that car?
It goes downhill fast. Yeah. You can't. There's no way it's going to be what you need it to do.
Yeah. So when we talk about things like therapy, I'd like people to kind of think about that like one of the maintenance type things that a person might need in their life. And rather than think about it as, as a crutch or as the kind of thing that people might think of as things that people shouldn't need, as a tool to kind of help keep going. And if you think about it in that way, then you understand that in order to keep going sometimes, in order to thrive and keep Blue Betty going, I'm going to give it that high mileage, oil. I'm going to give it that synthetic oil. I want Blue Betty to keep going. And so it's really important for me not to crutch it with high mileage oil, but to give it all that it needs, which is just a little bit extra with that high mileage synthetic oil every time I go that the new car's not going to need. And so that's my analogy for kind of where we go with some of those things. And I would also include things like medication for things like depression, other things that kind of get included in all of that. I don't like to see that as a crutch. I don't like to see that as something where people feel down on themselves or discouraged about having to take their anxiety or their depression medication. I like to see that as people saying, you know what, I am able to get where I need to go and do the things I need to do because I'm different. I'm a different type of person, but I'm able to still do the things I need to do.
Yeah, that's all. It's a good analogy. And the Blue Betty, real, not real?
Real.
Okay.
Sitting outside
Blue
right
Betty's
now.
out front.
Oh,
I had
yeah.
to ask, okay?
Absolutely.
Every car needs an oil change. Not every person needs
So
therapy?
every car needs something. And I think that's important, right? That's where
every car does need an oil change.
Yeah, every car
There's
needs an
no
oil
car
change.
that doesn't
Yes,
need an oil,
that
except
you're
for
exactly right.
What, Elon Musk?
That's
Yeah?
right. Right.
Those
That's a good
don't
point.
need oil
Don't
changes.
need an oil change. So does every person need therapy? That's where my analogy kind of falls down a little bit. Every person doesn't need therapy, but every person needs connection, right? Connection to people in some way. The branch needs a vine to connect to. And that's, one of those kind of New Testament, analogies that are great. We can only go so far as what we're connected to spiritually and who we're connected to. We have a capacity, right? We all have a capacity. And our capacity is as big as the people that we're connected to in order to help that capacity happen. Blue Betty's awesome, but she's not getting to California on how much gas is in her right now. Right. So my capacity to get to California is only as much as all of those gas stations between here and California. My capacity as a human is only as good as those in my life who can surround me and help me to get where I'm going. And sometimes that might include a therapist.
Wow. Yeah, so do you see that as a prime responsibility of someone who's engaged with therapy is to draw them back to the connection of their community? Is that the work that takes place there?
I think it's certainly you want that to be some of it. Yeah, you want to make sure that that those community connections are certainly a part of that. You want people to not have those important connections because those are the organic connections. Absolutely.
Yeah. But, would you say that those things ultimately they determine the wellness of the individual? Kind of back to this agricultural thing. You start.
Yeah. The
connections that it has really determines the wellness of the individual.
They really do. They really do. And the supports that we have that are sort of non-organic supports that are these paid supports, they're really, really important because they do something different that the organic supports can't do. But in so many ways, you can't do it without the organic supports. You're absolutely right. But there's some reason in people's lives where they've been disconnected from organic supports. In my life, for me, it was a divorce. I was divorced in 2015 and went to therapy. Was very angry, was very depressed, and had been disconnected not just from my ex-wife or wife at that point, but also the people that were in my life that were some of my primary connections. Anybody who's been divorced can kind of relate to that. Wow, I thought all of these were our friends, and now I can't get any of them on the phone. I can't text any of them because they've all sort of, they're awkward. They don't know how to connect with us. When I go to church, everybody kind of walks the other direction. It's an awkward situation.
Yeah.
I feel very distant from God. Whether I was or not, I felt very distant from God. And, therapy became that place to sort of deal with some of those aches and pains in a safe place. And that was really important for me.
You know what they say, that the doctor makes the worst patient.
The doctor
So as
does
a
make the
clinical
worst
therapist,
patient.
how did you do in therapy?
So here's one of the great things about therapy is you should be able to argue with your therapist. And I argued with my therapist
It's
a
good.
lot.
The boxing gloves and you tussle a
No.
little bit?
But I will say that's actually a sign of good therapy. I was a terrible patient in at that point, in that I was not ready to be very focused on some of my responsibilities. Now, I will say I have done therapy since that time, since this was right after the divorce, and have been able to really do a lot more deep therapy than that. But at the time, it was very much, she hurt me, I'm hurt, I'm disconnected from my kids, I'm very depressed, I'm very wounded. Because sometimes, and I think it's important to understand that, sometimes therapy is about soothing the present wound. Shouldn't be the whole time. Because if it is, if you're just soothing the most recent wound, then your therapy ends up just kind of being about, okay, let's just kind of put the Band-Aid on the most recent thing. But if you're going through a crisis and you got a new burn every week, sometimes that is kind of what therapy is about, right? You come in with a new burn, okay, let's put salve on the new burn. And when someone's going through a major life crisis, and that includes divorce, death, some of the, maybe a trauma, just post-trauma, therapy becomes about dealing with the aftermath of a very serious thing. You can't go back to why I felt like my dad mistreated me in the middle of a divorce. You just can't, right? You can't do that. You can't do the deep work in the middle of something like that, because it's just not, there's not a way to heal the severe brokenness that's happening right now in order to get back and unzip the guts of everything that causes the pain in the first place. I mean,
How long do you let someone stay in the need for soothing on the same wound for the exam? Is there a place that you reach where you say, oh boy, we're going in the circle here, we should be progressing a little quicker?
So I can't answer that for everybody watching, because every wound is different and every pain is different. Grief is a tough one. Trauma is a tough one. Somebody having gone through a really severe trauma, that can be tough as far as how long and how much healing you've got to do for the here and now. For me, it took years. And when I say years, I don't mean years as far as years and years of therapy. I did a year of therapy right after the divorce and felt like things were good, and only later was like, things aren't good. Things are not good. I need to go back. And so sometimes people will kind of realize, hey, I got to go back. And that's what I did in my life. I went back and I said, no, I need to get deeper. I need to get to, and you probably heard this analogy before as far as with, kind of getting to the root of problems. Dandelions are kind of that famous one where, if you pluck up all the dandelions, but you don't dig down to the root, the dandelions have a tremendously large root, and you can pluck them all up, go to bed, and come back out, and what do you find?
There they are again.
There's the dandelions, right? But that's also true with some things like a tree. You can cut a tree down to the very base, and if there's anything left alive in the root of that tree, it comes right back. And then suddenly you're trying to establish another relationship. You're trying to establish your life into the future. You're trying to just be nice to your kids. You're trying to just be a healthy human being, and suddenly the root of that thing that caused the terrible, deceptive, painful things that were going on before sprouts again. And you say, you know what? What I did is I cut down to the root to deal with everything that happened before. Now I got to go deep. I got to figure out what was going on before the before. I got to go back to the beginning. And that's a whole different process than dealing with the wounds of the moment. And it takes a whole different level of trust. I'll never forget the therapist that I did that with. I wasn't honest. Maybe you haven't had therapy. Maybe you've only had a sponsor, but maybe you can relate to this, or just in a relationship. At first, you really want maybe you've had a therapist. You really want your therapist to like you, or your sponsor to like you, or this person that you're around to like you. So you show your best front. Maybe not dishonest, but you're just like,
I've left some of the important things
you're
out
just
before.
leaving stuff out. Right. You're just leaving just enough out to where you seem like a better guy than you really were. And I did that. I did that in therapy. And then I realized, why am I doing that? What is the point of trying to make my therapist think I'm a great person? Well, the point of that is not changing, not getting better, not improving in where I need to improve. So
is it accepting responsibility?
Accepting responsibility.
Yeah.
And,
so how much of it has to kind of forecast the therapy by helping people understand, hey, this is important that you accept responsibility, and how much of the is on the therapist to help coach into?
So we always say therapy is, it's important to understand that the therapeutic relationship is a 50-50 relationship, and you get out of it what you put into it. So if you go into therapy and pretend to be a really great, nice person, and that everybody else around you is just a really terrible, awful person, and everybody mistreats me, and what I bring into the room is that the world mistreats me, and that I'm the victim, and everything and everybody else does me wrong. As a therapist, I'm going to work to challenge that mindset, and I'm going to work around the edges of that. But ultimately, your lack of honesty and willingness to accept responsibility for your life is going to prevent you from getting where you need to go.
So is there a place where you kind of got to say, hey, we're not getting a 50-50 here, and I got to say, we're just not you can see the barriers that are keeping someone from getting to that place. Do you ever have that responsibility as a therapist to say, hey, we're not getting there, we should try something different, to someone that you're providing that for?
I've done that before, but it's a risky move.
Yeah, tell us
about that. And the reason it's a risky move is because what I'm doing ultimately is rejecting that relationship instead of stubbornly pushing in on the willingness to hang in there in hopes that they will do what I eventually did. Now, I'm the one that walked away from therapy the first time and then came back later.
Which is better. Yeah.
Which is better.
It's your choice.
I said, "Oh yeah, I've done a year. I'm fixed." Which whether I was fixed, there was part of me that was fixed.
So it was progressively helping.
It was.
Right?
There were symptoms that were better.
Yeah.
I had my depression was much better. So if you kind of look at some of the things that at that point in my life were better, my depression was better. I was not laying in the bed, 14 hours a day. So some of those symptoms had improved to the point where I could say, I think I can conclude therapy. A lot of the wounds, the present wounds, had gotten better enough to heal. As I said before, it was not until later I realized, hey, the things that didn't heal were what could cause more relationship problems, right? More issues, more future problems, and more pain for some of my family members, for instance. And so these are things that each individual has to decide for themselves, because somebody else might say, you know what, I see that, and I want to work a program with my church, with my men's group in my church to do something like that. I want to go away on a spiritual retreat to deal with something like that.
Are those some of the common signs that someone's ready to end therapy? Is when they almost start preemptively disengaging from now I forget what you called it, the manufactured relationship, right? The one that, and then they start re-engaging with the organic relationships. They start saying, well, I've sorted. We were actually, and you might hear something in your conversation with them as a therapist. I just shared with this at my Celebrate Recovery group in church the other week. Or
sure.
Are those some signs that you pick up on that somebody's turned back to where the community can support them?
For me, Josh, it's so hard because it's hard to answer for other people. But for me, I was angry, and this was when I was talking about that 1 year. I was angry at God. I felt neglected by my church, and part of what I did during that year was my therapist was challenging some of those thoughts. Look, remember that guy came up to you at church and said, "Is there anything I can do to help? Call me." Do you remember, this and that? And I started realizing that my disconnection from my church was really because I was so sensitive about my change in identity as
clairvoyant almost.
Yeah, as being this family man to being this divorced guy, and I felt really bad about myself, and that I had disconnected myself. So some of what I did in therapy during that time was I needed to change my own thoughts about my own self, and when I did that, I was able to reconnect. So I would answer yes to that.
It's a good indicator that somebody's pointed back. And is that one of the only ways that you know if somebody's ready to end therapy?
It's one of the ways. I would say it's very, very different for different people. If you have someone who has a severe trauma or severe mental illness, then that may not be the indicator. We have folks that come to Coastal Horizons, and we say, well, look, as long as you're taking this very strong medication, we'd really just like to check in on you. So maybe you don't need to come and do deep work anymore, but every once in a while, every couple months, we'd like you just to come in, talk to us, let us know how life is going. That's a very different therapy. It's a short check-in. How's the medication working? Are you hearing any voices? Are you struggling to manage your life? It's more of just, let's make sure you're doing okay, and that's kind of a more long-term
And in the realm of severe mental health, you were saying that's
in
where
the realm
that
of
is?
severe mental health. So I don't want anybody to hear this and say, well, I shouldn't keep doing some of those check-ins. Folks who are taking very strong medication just need check-ins, okay? But in my case, my depression was based on my divorce, and I was able to really do some good cognitive behavioral therapy, which is a thought therapy, and overcome some really negative thoughts, and was able to discontinue that. Now, like I said, I hadn't finished everything, but at the time, I was able to say, yeah, I think I'm ready, and I think I'm done. I'm ready to kind of move on, and I felt good.
And when you see that in the most, I don't know what the proper term might be, but in the middle framework of people not dealing with the extreme mental health disorders, not on, very powerful medications to help support them through the process, but in the general sense, you're looking for a warm handoff to where they're going to continue to get the feel of that relationship from. And that's important that you see that before you guys kind of part ways from one another.
It would be. You certainly wouldn't, if somebody said, well, I'm ready to be done with therapy, they're very isolated, they're still showing a lot of symptoms, then I would want to just ask why. What's going on with therapy? If they're ready to be done with therapy because there's a cost barrier, or maybe they're struggling with me as their therapist, if there are other issues that are causing them to not want to continue therapy, then my job would be to say, hey, let's see if we can overcome that. Let's see if maybe we can help with the cost of therapy or get you to a different therapist, because it still sounds like maybe you're not there yet. You're still really depressed, really isolated. You're still using some substances, or you're really not where you need to be to discontinue therapy. You're not going to any AA meetings. So there's some signs there that you're really not where you need to be to just totally discontinue everything. Things actually could get worse for you.
In the beginning, you made the comments around, therapy is not a crutch. When does it become a crutch? When do you have someone who, all the signs, and I see this in the recovery world for myself, they have made themselves whole. All of the signs of an active member, committed to their community, they've restored the relationships, they're engaged, they're really moving forward and advancing quickly. And then there's these couple things that they're like holding on to them so tightly, and now the thing that once supported them has really become an anchor, kind of keeping them from the next step. What do you see there?
I'm getting ready to make somebody mad. If therapy has become a crutch for someone, then the therapist is not doing a good job. And the therapist is the one who is responsible for that, because ultimately our job as therapists is to bring the person from that sort of healing salve moment, healing balm moment, to the place where they're making those longer term changes, and that they ultimately do not or will not need us. There's a thing in therapy called person-centeredness, and ultimately we've kind of messed up person-centeredness, because person-centeredness is about the person, and it's about making sure that the person understands that they have deep intrinsic value, okay? That they have, everything within them that is needed to overcome any single thing. And what therapists have done, don't send me no letter, is said that every behavior, good or bad, that we do has value. or whether it's good or bad, the behavior, it's good. And so that ultimately people enter into the therapy room, and my client says, I screamed and yelled at the cashier, and the therapist thinks it's their job to say, that's okay. It's good for you to scream and yell at the cashier. And that is not what person-centeredness is about. Ultimately, our job is to hear our client say, okay, there's this dysfunctional behavior in my life, and I'm not going to affirm these behaviors that are keeping you dysfunctional. I am going to affirm you. You can overcome these dysfunctions, and you can get to where you need to go. So let's do that good work, and let's work on that. So if you have a therapist who's saying, awesome, I'm so glad to hear that things are going really well in your dysfunction, that may not be the best therapist.
Not a very empowering message.
No.
Instinctually, we know things that don't make us as humans feel great the next morning.
That's right.
And I think you and I have talked about this in the past, like our emotions and the way we feel in response to situations in a healthy format serve as like a yellow warning light.
That's right.
Like, stay away from that thing. Remember, it didn't make you feel the most encouraged, type of deal. And then, so you're saying that in some forms, it's extremely harmful to reinforce those as positive behaviors.
So part of therapy is enforcing our responsibility for our lives. That is an really important part of therapy. And if we reinforce that we are not responsible for our lives, not responsible for taking control of our day-to-day, and instead reinforce that we have no responsibility, that the rest of the world makes us victims, that the rest of the world kind of acts on us in certain ways, and that we can sort of be okay with whatever behavior that sort of exists, we're not doing good work in therapy. And that's and if that goes on over a long period of time, does that mean that therapy has become a crutch? It's probably been a crutch since the first day the person has been in therapy. And that's all I'm going to say about that, because I've probably already made somebody mad, Josh.
Well, I appreciate the insight there. And, instinctually, there's a scenario that I always work up in my head about it. And maybe it's a bad scenario, but I'll ask it anyway. A loved one that I care very much about, hypothetically, has just passed away. And I'm having a really sad time, right? How do I know when it's sad and it's depressed?
Sure.
Help me thread the needle between those two things. We're supposed to respond and be sad.
Yes.
We're supposed to feel those things, and sometimes I guess the line gets blurred. And I work with, for full context, working with the folks in recovery, a lot of times when you're talking to them, they really want to jump themselves into these huge labels.
That's correct.
And I'd say, I don't know if you want that on you right now. And I'd say, let's just look at your situation for a second. If Billy Graham, the most spiritual person of our generation, had gone out and done the things that you've done over the past 5 years, he would probably feel similar to you. So I don't know if you're there, to where it's...
Right.
Is there a responsibility to first try to adjust the way that you're interacting with life before you jump to labeling it that?
I think that's such an important conversation, because this, especially in the age of TikTok, Josh, everyone is self-diagnosing with something. If you look on TikTok, especially the younger people, everybody is self-diagnosing with autism. You can't self-diagnose with autism. I'm sorry, folks.
They say WebMD is our worst nightmare, right? They say WebMD didn't do us any favors.
And it's sort of like I just watched a 30-second TikTok, and now I can say I have bipolar disorder. It's really not a healthy way to decide that you have certain disorders. That's not the way to do it. But I think it's okay to affirm when people are sad. Mm-hmm. It's okay to affirm, hey, I'm hearing you say that you're feeling grief, but also level set that. Okay, I'm hearing you say that you're sad or that you have grief, but there's this thing for diagnosing, and it's the DSM-5. And the DSM-5 is what we use to decide when someone has a depressive disorder. And there's a period of time where somebody has to be depressed, and they have to, do certain things like lose or gain weight, or not sleep for a period of time, or sleep too much, or they have to, So there's a series of symptoms and check boxes that a professional clinician has to go through in order to make a diagnosis. And there's a period of time that someone has to experience these symptoms. And since you just started this 4 days ago, then you're not going to meet that period of time. But I want to just affirm with you and sit in that space with you that you might be feeling really sad, or might be even feeling you can feel depressed without having a depressive disorder. You can feel anxiety or anxious without having an anxiety disorder. But also, I think it's important for us to talk to younger people. It's disrespectful to people who have been through really traumatic incidents to say, oh, my PTSD. That's actually disrespectful. People who have been through a wartime, people who have been through a violent attack, a sexual trauma, and then I say I have PTSD because, my mom made me do too many chores. And I've heard that kind of thing. So we need to be really careful with our language and help other people level set with language.
Yeah, I see that in our society too today. It does have something to do with the media age, access to all of this other information. And you do see this too in the world that we both work in, substance use disorders, that they're kind of looking for a medical, diagnosable, mental reason why they pursue drugs and alcohol.
Sure.
There's not always one, right?
There is not. Obviously sometimes there's genetic factors. There are environmental factors, and sometimes choice is the factor.
Addictive substances, translate into addiction.
That's correct.
For anyone.
That's correct.
Yeah.
So you can't always find an exact specific reason. There's a myriad of reasons, and it could be any one of those things for sure.
How hard? There's a idea of what you have, the healthy person looks like. It's not lost in the ether of opinion. There's clean indicators that somebody's well engaged, living a healthy life. Some of us talked a little bit about their social engagements today, about what that looks like. How hard do we nudge in that process to get people closer towards that fullness of life that we're describing today? How hard do you encourage? How hard do you push? The quick joke, LJ, he struggling with some bashfulness, being a 4-year-old, my son. And one of the things that I always had taught him to do since he was 2.5, he goes and introduces himself, shakes people's hands. Now he'll do it pretty quickly. He'll just pick up right on it. But I remember when he was 3, I was really scooting him. Hey, go introduce yourself to these guys. Go shake their hand. Go say hello to them. And I see that in the sponsor version of me. You're a therapist version of me. Don't forget, I'm just a sponsor version of me.
Sure.
But I sponsor guys actively today, and I don't really take a pause whenever it comes to pushing them, to do the things that I perceive, because it really is me working with them one-on-one, that I would say, hey, these are things not only that would be good for them, but I instinctually see them desiring to do. Like they want to, they want to move in that direction. They're telling me they want to, and they're just a little bit skittish, almost like a little deer over there walking across the yard. I say, no, go ahead. Let's go ahead and do that. Do you feel that responsibility?
I think so. I think for a sponsor, that is absolutely right in your wheelhouse. My pastor has said the same thing about some of the young men of our church. And for our elders and pastors, I see them doing that, and I love that. I think for therapists, sometimes we take the chance to do it, but I think it's got to be a calculated decision. Going back to me, I think, as a client, not as a therapist, if during that year of therapy, right after my divorce, if my therapist had said, look, we're going to put all of this talk about your wife aside right now because none of this matters. We need to talk about your childhood. I wouldn't have been back the next week. That's part of the problem with that kind of pushing is you got to know when to do it. Mm-hmm. And what you said to me is you've got your sponsees, right? And they're skittish deer, and you can see that they want it, right? You can see that it's their desire to take the step, but they just lack that just little bit of initiative. And that's what I would say as a therapist, anytime that I have pushed somebody to take that next step, I got to know that I know that I know that when I'm giving that homework to the person or I'm kind of pushing deeper, even in the session, I got to know that this is not going to be a catastrophe, right? This is not going to be opening up the guts in a way that is going to cause more damage than it's going to be helpful, because these are really potentially very painful and sensitive areas, especially when it comes to childhood trauma, when it comes to some people's backstories. There's a lot going on from the client perspective when it comes to some of this, and there's a lot of trust that we have to build, and we don't want to lose trust.
When you're working with someone, or even somebody's hey, I've been in therapy for a year, and I'm feeling good. Things are moving in. I'm moving back to the organic relationships aspect of the community. What's kind of the indicators that you're going to say, yep, you're ready to exit therapy, the formal process of therapy?
So what I would say is this is what is preferred by therapists. Don't just not show up to therapy one day, okay? We hate that. We don't like that.
Well, I guess he's done.
Yeah. Yeah, and that actually happens more than you realize, that people literally just don't show up one day, and it's like, well, okay, I assume that they feel like they're better now. And that's fine. I mean, if that just
give yourself a self 5 and be like, good work.
Yeah, that was great. Thank you. Showing up and having that conversation, because as I said before, therapy is a 50-50 relationship. It's likely that your therapist will say the same thing. Man, I've seen, especially if it's been a year. A year is an expected time frame. If your therapist sees that you've been meeting the goals that you set for yourself at the beginning, and you have been working the steps that you guys have made, remember, it's your steps that you said from the beginning you wanted to be working on. If you haven't been working any of your steps for a year, your therapist is ready for you to go too. So, he's done a year of you not doing any steps, so he's probably ready. And that was kind of a joke, but yeah. So you've been doing those things that you were supposed to do, and then the two of you talk about, okay, what's next? What do I need to do to continue the progress that we have been working on? No therapist should ever think that therapy for something like a short-term crisis in your life should last forever. Now, as I said before, there are reasons why someone might need to stay in therapy because of a really severe, long-term, lifelong issue. But like the one I mentioned, or other things that are more short-term issues, at some point you're going to achieve your goal that you set at the beginning of therapy, and you're going to be able to say to your therapist, I think I did meet it. And that's going to feel like a really good session, okay? It's going to feel really like you're able to walk out of that having done something really nice in your life, and that you're moving on into something. You will have already talked about some of the social supports. You will have already connected. This won't be ethereal. You will have already been connecting with these social supports, and really the practice will be being done. If in therapy you're not already practicing getting homework, then something's also not going right. There should be homework happening in order to achieve and meet the goal. So that it's taking that step into doing the things that you've been working on doing.
Is there ever a time that you would say, hey, what do you think? You know, you're checking in with the client that maybe they just have developed kind of the systematic approach. I have the appointment, I show up to the appointment, but you're sitting back as the therapist and you're thinking, wow, John's really killing it.
Sure.
You know, everything. What brings you to that place to where you check in with John and you say, hey, brother, I'm getting the feeling that you don't really need me anymore.
Absolutely.
Do you ever draw that play? I imagine that would be the biggest win for the therapist, is when the person doesn't even realize it, but the therapy has been so effective.
So remember, it is mutual. And so if I say to John, hey, you know, I think you're doing well, I think you're doing great, and then John says, I'd still like a couple. All right, let's talk about that. What is your anxiousness? What makes you concerned about that? Because you have the skills in place, you've met the goals. What's going on? What's causing you to feel anxious about that? But yes, absolutely. The other reason, and obviously not a desirable reason, but the other reason why a therapist might end therapy is not making progress. And hey, I really need to send you to someone who's more of a specialist in something else, and be able to make better progress in what they're doing. And that doesn't always feel great, but I'm only human, and I don't specialize in some things. So I've got to be able to make that assumption that I've got to be able to let somebody grow beyond what I can do.
Yeah, this has been a great conversation. We've been able to flush out a lot of the finer points around therapy. The thing I appreciate the most about it is two perspectives you offered today: going through therapy, and then some of your professional experience as a therapist. Yeah, and I thought blending those two were perfect. Folks, today, Jeremy Seamon, Director of Coastal Horizons, coming out to share a lot of his personal experience, some of his professional experience. Thank you for being a part of it today.
No problem.
Yeah, thank you all for tuning in. We'll be back next week with another follow-up of the greatest conversations you've ever seen.